So now on this machine here, it has the power switch right here onto the back area, okay? And you turn that power switch on. It also has a mode switch, and on the mode switch, it's going to tell you whether or not you're using the LED light, whether you're using the suction, or whether you're using both. So we're actually going to set the mode on here so that the light is on and the suction is on. Both lights are now lit up. Now on the vacuum, I can either have a mild suction or I can have a strong suction. When we worked on Nicole's neck, I moved it down to the mild section. On the rest of her body, we put it up into the strong section. So I hit vacuum. First the mild button goes on, then the strong. So I want it on the strong if I'm doing for the most part of the face. If I'm going over broken capillaries or sensitive areas, I turn it down to mild. And then on the machine itself, your LED lights are around the edge of this, and then your disposable tips just pop in to work with them, and then you can take them out to dispose of them. And when they pop in, and it goes all the way down into here, we're already set up, and if I hit the start, now I have an LED light, my vacuum is working into here, everything is going well. I go ahead and turn stop, now I can take out that tip, and I can put a new tip in. That's simple. So the tips are stainless steel, okay? Therefore, they're not diamond tips, so they don't last as long. So they're disposable. That's why they're not as expensive as well. But they come in fine, medium, and coarse, depending upon what area you're working over. If I'm working on scarred acne skin, I would want coarser. If I'm working on more delicate skin, if I'm dealing with somebody who has rosacea or somebody who's got broken capillaries, and I want a finer grit onto there. And then, of course, again, also it has just the plain one for your lymphatic drainage. So I pop this one in. I want to make sure that my mode is set. I want the light and the suction. Both lights are on. My vacuum, I like to have it on strong when I'm doing lymphatic drainage. There's no abrasion with this. I hit the start button. I can do LED light and lymphatic drainage at the same time. I'm going to be doing microdermabrasion. With this machine, it has disposable tips. Not only does it have disposable tips, it has different grits. If I'm dealing with somebody who has got like acne scars or thickened sun damaged skin, I might use the coarser of the head. One's red, one's blue. The blue is coarser, the red is finer, and on Nicole, I think I'm going to use the finer one. Your tip just slides right on in. And I'm going to start working on my pattern, on my grid. I'm going to start in the glabella area right in between her eyes first, and working just in an upward stroke away from the nose, creating like a little fan. Now I'm going to go in with the vertical lines. I'm going to come from the center of the forehead out to the temple, and I use a very light touch. I allow the skin to come up to the tool versus me scraping it across. You have to keep your tool at a 90-degree angle from the skin or else it jumps off. Now I'm going to come from the eyebrow up to the hairline, finishing my grid. And remember, the face is round. It's not a square, it's not flat. Keeping the tool at a 90-degree angle all the time that you're coming across is really, really important, or else you're going to hop, skip, and jump it across the face. You're going to see a little bit of redness in the skin. That's normal, but that redness shouldn't last but just a few minutes, and it should subside. Now, if I'm working on scar tissue, I may want the redness to stay there a little bit longer. I just want to stimulate the blood flow, so it'll stimulate the fibroblasts, which will produce more collagen and elastin. Now coming up, and I hold the skin lightly. You don't want to hold it too tight because you actually want the skin going up inside that hole. The tip itself has a little filter in it, and that filter is catching any of the dead skin that was coming off of it, and oh, her skin is feeling smooth. We could do 2 passes with this, and as a matter of fact, I'm going to do that with her. So we do 1 grid, then we're going to do a 2nd grid. If she had acne scarred skin, I may do 3 grids, and even up to 4 grids, depending upon how thick that skin is or how scarred that skin is. You want to keep a nice even speed when you're working with this. Don't go too slow, or else you're going to leave hickeys. Don't go too fast, or else you don't abrade enough. I want to come up underneath that where they get a lot of stress outbreak. So if she's got a real sharp jawline and I have a hard time coming all the way across the jaw, I'm going to come right to the point of the jaw, and then from the point of the jaw to the ear. If you feel like you have good control of your wand, then you go from the tip of the chin all the way to the ear. But when you first start, that might be a little bit more difficult. Making sure I keep this at a 90-degree angle. Also, when you release it, you don't release it coming straight up because you're going to create a hickey. So when I release it, I actually turn my wand down, and that releases it gently so you don't give her a hickey. And again, I'm holding the skin lightly, not too taut. Now I'll go to the other side. And on this side, I may not feel like I have as much control, so I just go to the sharp edge of that jawline, and then from the edge of the jawline on across. And then down. I'm going to have you pull your lips in lightly, and we're going to do the chin. And on the chin, we're going to come across it. Now I go to the cheeks, and on the cheeks we're going to come down from the orbital bone down to the jawline, and then from the nose out towards the ears. Turn the head to the side. As you come closer to the orbit of the eye, you may need to hold the skin, especially on more mature clients. So if you need to hold the skin, just taking your pinky, lightly holding it up. You know, if you have a client who's got really lax skin, maybe a more mature client who has like a Glow-Gal 4 type skin where their skin wrinkles really easy, you may even need to hold it a little bit firmer. So now we're going to come across horizontally, and I seem to be losing control as I round around by the ear. So I'm only going to do half, from the lips to the side of the face, and then from the side to the ear. But you can take this right up to that eye line. Remember where our tool is here. So when it looks like I'm going right onto her eye, the tool is here, the light is just coming up. So I'm really coming right up into that orbital area, right up next to the lash line, which is really nice. And then the side. What's nice about this microdermabrasion, there's no crystals, so you don't have a lot of crystals falling into the ears, falling all into her hair, getting into her eyes and her nose. Come on to the other side, same thing, coming down. And you want to watch. If you notice any little pediculi, little tiny blood specks, then you stop. You don't keep going. That means that the skin is too thin for this, okay? And now I want to go into the temple area. When you're working in the temple area, right into here, close to the eye, I always start at the hairline and work in towards the eye. The eye's really sensitive. So I'm going to start the hairline, coming in now close to her eye. I watch her body language, because if it gets too sensitive, she may jerk a little bit, then I know that it's too much and I back off, because you can get right into those crow's feet. And you can see where that little redness is right into here. It's great. And then from here, I'm going to come from the corner of the eye out. So we're finishing our grid. Starting at the hairline, watching her body language. Sometimes the clients won't tell you that it's hurting them, but it is. So we just watch the body language as we go in, getting closer and closer right into those crow's feet, right up into here. Now we're going to come out horizontally, and now we're going down the nose. I hold here at the glabella, holding the skin slightly taut, coming right down the tip of the nose, and then holding the nose to the side, coming down the sides of the nose, working in that nasal foci. This also helps to remove any microcomedones that may be in that area. And when you're working on the nose, she doesn't have a bulbous nose, so she doesn't have much on the tip of her nose. But some people have more of a bulbous nose. You can take the tool, come right around that bulb and work around it, because a lot of people get a lot of microcomedones on that tip. So working all the way around on that tip area as well. So I need to finish your upper lip, so I'm going to have you put your lips in one more time. Coming from the center out. This is a very sensitive area. You can't create a grid here, it's too small of an area, so I just do my vertical lines. So we'll go ahead and turn our machine off. You can actually see on the tip of here some of the dead skin, but there's a filter inside here that collects a lot of it as well. So when you take this tip out, you can just throw that away. I like to rinse her face off now. Even though there's no crystals on her face, there's still a little bit of dead skin cells there. How do you feel?
Fantastic.